Hello, viewers, and welcome to this week's edition of the program Platform. My name is Lynn Ada. Malaria is considered as one of the killer diseases globally, and several efforts have been made by government and non governmental organizations towards addressing this challenge. Our focus in this edition of the program will be on the activities of the civil society in malaria control, immunization, and nutrition, ACOMIN. And I'm being joined in the studio by the national coordinator of this non-governmental organization, Mr. Ayu Ipimo. So you're welcome to our program.
Thank you very much.
I hope
Thank
I
you for
mentioned the
having
name
me.
correctly.
You are correct.
It's
Thank
okay.
you.
Maybe you give us a background of ACOMIN.
Thank you. Good morning, viewers, and good morning to Taraba State. ACOMIN is a national network of non-governmental organizations, NGOs, community-based organizations, and faith-based organizations that are focused on three major areas. One is malaria, the second one is immunization, and the third is nutrition. These three are very instrumental in the morbidity, that is, the number of children and pregnant women who die. Most people die of malaria, infectious diseases, such as we have polio, we have cholera, we have typhoid, and all these other diseases that are avoidable but very infectious. So, and for many of them, even tuberculosis, we have vaccines which we are supposed to take: measles, cholera, also infectious diseases which we catch from each other. So, ACOMI promotes the use and demand for vaccines to prevent this. And then the third aspect is the nutrition, what we eat, what we drink. We find out that more than 90% of all fatalities of all diseases can be avoided through improved nutrition. If we improve our nutrition, then automatically immunity of the body improves, and the ability of the body to fight off diseases improves. A lot of debts that we have also have to do with the water that we drink. We drink bad water from streams, from all different types of sources. They're not clean, they're not purified, they're not well stored. So when we take these three, malaria, infectious diseases, and nutrition, if we are able to solve this, we are solving the problem of health for our people. But for our visit to Taraba in this instance, our focus is on malaria.
Okay. Why malaria? As that question.
Well, malaria is one of the most endemic diseases in our region, in our country. Malaria is one of the most significant public health problems that we have now, that is killing, to use our layman language, that leads to the death of children under 5 and pregnant women, and leads to a lot of negative consequences in the general population. Uh, but because of the public health importance of malaria, not just here in Nigeria but across the world, the Global Fund um, for HIV, TB, and malaria put together a package of health interventions for Nigeria. And Global Fund is funding those interventions in 13 states in Nigeria. Taraba is one of the states. And ACOMIN is one of the major implementers for Global Fund, helping to ensure that people have the services, they have the knowledge, they have the information, and then they have the skills to prevent and to treat malaria. So we have been working in Taraba State now on this project since 2019. Previously, from 2010, we've been active in Taraba State. But on this particular project, from 2019 up to now, we've been working and moving from one local government to the other, empowering people and holding implementers accountable, ensuring that communities, government, civil society organizations, faith-based organizations are working in partnership and in synergy to promote prevention of malaria and provide treatment for those who require it.
Okay. Why are you in Taraba at this particular point?
Well, I'm in Taraba just to see our people, to visit some of the relevant government agencies, to say thank you to them for the work they are doing, and for the partnership that we have, and also to encourage more of that relationship building. You see, health is not something that we should leave for the government alone. Where health of the people it really improves, we understand that it is a partnership between the individual, the community, the government, and other agencies and partners. All of us must put hands together to assure improved health outcomes. But you see, of late, there's been a move to leave it for the government alone. But it is not possible for the government, no matter how rich or poor the government is, to take health alone. So we are encouraging and mobilizing communities to take ownership at that local level. Let's give an instance. Malaria is responsible for more than 60% of visits to the primary health care center. All the patients that are seen in the outpatient department, in admissions, 60% of that is due to malaria. So imagine how overworked the medical personnel are just due to malaria alone. Meanwhile, malaria is easily preventable if we do the right thing. And if you are not bitten by a mosquito that is infected with malaria, you cannot get malaria. It's not something that's automatic that we get. A lot of us say, well, it's rainy season. Before this rainy season is over, I must get 3 or 4 episodes of malaria. We are used to it. We accept it. We are friendly with it. But it should not be so. It is not something that's automatic. If you do the right thing, the agent that transmits malaria is the mosquito, female Anopheles mosquito, and it only lays its eggs in stagnant waters. So, if we should avoid stagnant waters in our environment, we channel all waters to be flowing, we have solved a major part of the malaria problem. And then, now rain is falling, if we ensure that within our environment we do not have containers, um, and all the other things that store water for mosquitoes to come and lay their eggs. And when there are no mosquitoes, there are no malaria. As simple as that. So if we reduce the population of mosquitoes that are hatching and growing in our environment, we are automatically reducing the population that has malaria. So how do we do this? It's the communities, it's us. We should be taking charge of our environment. We should be ensuring that now that the rainy season is here, that we're doing everything to ensure that we are not growing and farming the mosquitoes. A lot of our people now in the farms are farming crops, but we're also farming mosquitoes by what we do. So that's what we are saying, that if we must reduce the severity of malaria infection, then we as community people must also take action that is necessary to ensure that our environments are free of stagnant waters. And more than that, when our children are becoming feverish, rather than keep them at home, we should immediately seek medical help. All of these things are being provided around the environments at the primary health care center. Global Fund is making free commodities, the drugs, medicines that people will take, making them available. So if we go quickly, they will do a test for the child or for ourselves, for pregnant women. And if you are found to be having malaria parasites in your system, you are treated. Chicken out is over. The other thing is, Global Fund and the government make available insecticidal treated nets, which means that the nets that we're supposed to sleep in have been treated with chemicals that when the mosquito lights on it, the mosquito dies. But if we take those nets and we don't use it for sleeping, we use it for farming, we use it for clothing, and for many other things, in fact, for fishing, then the purpose is being defeated. Again, that comes back to the community. So if uh, the donors and the government and all these agencies are pushing all these nets, giving them to us free or at very severely, significantly reduced prices, and we do not use them appropriately, then we have ourselves to blame.
Now, if you are going to specific areas, what are those activities that acronym carries out every at UNIFEM?
Okay, thank you very much. The specific activity that ACOMIN is carrying on at this point, we target community-led monitoring. That community-led monitoring has two components. One is accountability, the other is advocacy. I will explain. When we talk about accountability, we are talking of the need for everyone to do what they are supposed to do. If we are going to escape this crushing burden of malaria, everybody has to do their part. So what we do as ACOMI is to mobilize the community, train them, empower them, and work alongside communities to now focus on one, the primary health care centers, to be sure that they are giving the services they are supposed to give. When the medicines are provided, to be sure that those medicines are not being sold but being given to people for free. We also want to ensure to hold accountable communities, like I said earlier, to be sure that the nets, these mosquito nets that are being provided for them, they are using them appropriately. They are not using them for farming or for fishing. It is to save lives, not to fish. So we come into the community and ensure that those communities are doing that. We also work with the government. The local government are supposed to provide the staff for the primary healthcare facilities. We interact with them where the staff are not available. We work with them to ensure that they provide the staff. And when they don't have the resources, to see how the local government and the communities can mobilize volunteers to also provide services. So then we also check the work that's being done by implementers for Global Fund, those who are supposed to supply the medicine, those who are supposed to do the supply chain, that is moving the product from one place to the other, to be sure that they are doing what they are supposed to do. Because if nobody checks what they are doing, then they may just do anything. So with those accountability checks that are being done by the civil society and the community, when we see any gaps, when we see any areas of challenges, things are not going well, then we begin to do advocacy to those who are supposed to do that. So we do not see the challenges and write petitions. No. When we see the challenges, we go to those who are supposed to make a difference, and we sit down with them and ask questions. How can we solve these problems that we're seeing? What can we do that the medicines that are supposed to be available are being provided for the people? When we do not have enough staff members, what do we do to ensure that staff members are recruited and posted to the private healthcare facilities? So, is it if it's financial resources? Then do we go to the state assembly? Do we go to the state ministry of health? So there's always a solution. But one of the things that we have also done successfully is mobilizing the communities to take ownership and provide some of these resources that are required. Now it's rainy season. There's lots of heavy rain and wind. But in many of the primary healthcare centers, we find out that during this rainy season, some of the roofing sheets are blown off. And what we do in those instances is to mobilize the communities to replace the roof. I mean, like they say, a stitch in time saves nine. If the communities will take ownership and replace those five or six sheets, which they can easily do if they tax themselves 2,000 naira, 1,000 naira here, put them together, you find out that you save that building from serious damage. Because when water begins to pour in, it damages everything. So, what we have seen is communities in Taraba are tremendous. And I think we should thank our community leaders. In all the communities that we are working, we have seen community members take ownership of the maintenance of the primary healthcare facility, which the government alone cannot do. Let's be realistic. the sources of revenue for government is dwindling, and there's so much for them to do. So if the local communities will take ownership for at least what they can do in maintenance of the facilities that they have. We have communities where they have replaced the windows, they have replaced the doors. We have communities where the community members have provided furniture, they're providing beds. They're actually volunteering their services for security, for gardening, for data entry. So you find out that that movement is growing for community members seeing that we also have a role to play in assuring our own health outcomes. The other thing is also this, which we have seen in Taraba, the conflict between the settlers and the indigenous communities also affect our demand for and usage of health. When one part of the community say, well, we are not involved in that, they didn't talk to us, they didn't carry us along, so we are not even going to access the services. When our children are sick, we will not take them to that facility because we are not recognized there. And we are letting people know, listen, whether you are settler or you are indigenous community, malaria and mosquitoes do not respect anybody. When your son and daughters are ill, take them for treatment. Don't allow your child to die because you are quarreling with someone. Because at the end of the day, one of the things that unite Nigerians is malaria. Whether you are Yoruba, you are Igbo, whether you are Fulani or you are in Yaro, you are in Lao or wherever, whether you are Jukun or you are Tiv, I can assure you malaria does not discriminate. So if you are in a local environment, all of you should put hands together for the sake of your children to ensure that the health systems are functioning. And when people understand this, sincerely, we have had chiefs of two, three communities are not even talking to each other, now coming together to collaborate. To say, well, we are quarreling over so many things, but for the sake of the health of our wives, of our daughters, and of our children, we will do this. And when that is done, it's been beautiful. So that whole aspect of ensuring that the communities are functional, the communities are taking ownership, the communities are contributing, it has been one of the missing links in health care provision in Nigeria, and that's where we are focusing on.
Okay. Now, as the national coordinator, which you have been using for some years now,
Yes.
what have you been able to identify as the major challenges that you try to achieve your aims out of it?
Well, thank you. One of it is what I've been describing, the ownership by the community. We really want to see communities own their own health outcomes. We should remember this. A healthy people is a wealthy people. Like they say, health is wealth. That's number one. The other challenge that we'll be having is the inability or unwillingness of our government to put resources in health. In many states now, we see that governments have left health largely to partners and foreign donors. We cannot and we should not leave the health of our people to donors. No matter how good intention the donors have, one day they will leave and we are left with a damaged system. So whilst the donors are with us here now, we should use that as an advantage to quickly ramp up the capabilities to improve and to solidify our health system. We should put money in health. We cannot generate wealth without health. And when your people are dying, then who are the people that you are administering and being governor or president or senator over? If you are superintending over a sick people, then maybe the whole system is sick. So we should start to put more effort in health uh, alongside other areas. But maybe we should prioritize health above everything. When people are healthy, even insecurity will go down because people will be healthier and they'll be able to work. So that tendency to be angry and to want to fight will reduce.
Okay. Now, most agencies collaborate for them to succeed. What has been the level of collaboration between ACOMIN and other partners within the health sector?
Oh, yes, thank you. ACOMIN is collaborating directly with the National Malaria Elimination Program. We sit on all the relevant committees. Then we partner with Global Fund at country level. We sit on the country coordinating mechanism. ACOMIN for now occupies the seat of the second vice chair, which the Minister of Health for Nigeria is the chairman. And it's that country coordinating mechanism that brings the resources into Nigeria from Global Fund. Apart from that, at state level, ACOMIN is partnering with the state malaria program. We are partnering with the primary health care. We are partnering with Taraba Television. Thank you to you for the good work. And so you say that for us to succeed, the little success we are having is because organizations, agencies like Taraba TV, like the Commissioner for Health, like the Permanent Secretary, all of these people are partnering with us and the agencies that they represent. National level, state level, and community level.
Okay. Now, give us the global picture of the situation of malaria.
Wow, the global picture. Uh, Let me start with the bad news. 25% of all deaths in malaria come from Nigeria alone. The global burden of malaria deaths, we are contributing one quarter of it, Nigeria alone. And that should be a thing that makes us sad and ashamed. That the whole world is saying Nigeria is the most significant contributor to malaria. Then we have now over 500,000 people dying from malaria every year across the globe. And that is death. And then the number of people who are sick from malaria run into millions. And those people have to spend money, effort every year treating malaria, losing days out of work. Then in Nigeria, 60%, like I said earlier, of all outpatient clients come from malaria alone. So we see that malaria has this huge impact on our communities,
Let
on
me
our
let's go to
systems.
the good news because time is not on our side.
The good news is this is a battle that we can win. Malaria is treatable, is preventable. We were actually on our way to eliminating malaria before COVID. With COVID, there have been a reversal, but now we are back to the fight, full force. When we join hands together, we see that over the next 5 years, we bring malaria incidence down to a minimum. And then over 10 years, we are talking of about being able to eliminate it so that malaria becomes history. And that's what we are working
Okay.
towards.
Thank you very much, Mr. Ayo Okunye, for your time here. Thank you. Hope the next time when you come to Canada, I'll invite you to come and share your experiences with us.
Thank you.
Thank you very much.
Thank you very much.
Viewers, for the past 25 minutes or so, we have been discussing with Mr. Ayo Okunye, the National Coordinator of the Civil Society Malaria Control Immunization and Nutrition. Join us again same time next week for another interesting episode. Bye bye.